All right, everybody, here is the third and final phase of this lecture. So we're going to talk about dysphagia. So first, we're going to start off with what is dysphagia even? So this is a swallowing disorder, and it's caused by difficulty with moving food, basically moving the food from your mouth to your stomach. So not being able to just essentially move the food down. So literally a swallowing disorder, exactly what it sounds like. So in swallowing, we have 4 different phases of swallowing. And these are the 4 phases of swallowing. And a client can have an issue with any one of these 4 phases of swallowing. So I want you to take a look at the picture on the right-hand side here. And you'll see when you are in a medical setting, you are going to be doing mini swallowing exams. Like that's going to be part of the definition of your job that you're doing. And so you're going to get really familiar with these particular types of pictures and being able to identify, is there aspiration? Is the client having any issues with the swallow? And if so, where exactly are those challenges coming in? So we want to know that there are 4 different phases of a swallow and be able to identify where the issue of the swallow is happening. That'll be part of our job as the assessment. So why might a client have challenges with their swallow? So here are multiple reasons why a client might have challenges with their swallow. And so you need to be aware that there are many factors that could impact the swallow. So we do want to make sure that we understand that it's not just one particular thing, but multiple things that could cause it. So again, we have to talk about, I apologize. This is actually a video. I almost forgot. Let me replay that for you so you can watch that. So I want to watch that again. And we'll talk about this video in class as well. Okay, just so that you have an idea of what's going on there. And we'll take a look at that. We'll take a look at that together in class. Sorry. So there you go. All right. Okay. So again, what we want to talk about are the different treatment approaches. So as we talked about with the other parts of this particular lecture, it's important that when we are doing the assessment that we're also looking at treatment approaches, because for our adult clients, for motor speech, during the assessment portion, we need to know what treatment is going to be effective so that we can write those treatments into the goals. So unlike when we're working with children where we don't necessarily pick the treatment right away and how we might vary our treatment from day to day, and we can vary the treatment even like within a setting, unless you're of course picking a very specific program for a child. With our motor speech clients, it's going to be critical that we look at treatment at the very time of assessment so that we're picking the correct treatment. So there are some compensatory strategies that we can offer our client. There are strategies that change the client's swallowing pattern, so therapy strategies, and then strengthening strategies as well. So what I'm going to encourage you to do on the next slide is actually pause the lecture if you want to and go get some food or a drink. And I want you to actually practice these particular strategies. And I think it's really important that you understand these strategies before you actually suggest them to a client. And the reason why is because you need to understand what it's like to actually go through this before you suggest that a client does this themselves. So you'll see that we have various strategies here. And what I want you to do is I want you to practice them. So put a little food in your mouth, tuck your chin down. So chin down, and then swallow and feel what that feels like. And we're asking the client to practice this on every swallow, right? So think about how challenging that could be. Chin elevated, and you'll see also, if in case you didn't notice, that underneath each one actually has a list of the disorder that this would be useful for. So you can kind of take into consideration, if my client has this particular challenge going on, then this would be the approach that we could use. Chin elevated is literally what it sounds like. So if you have an ALS client, so having them put their chin up and then swallow. Head turned to the weak side. So if we have this unilateral damage of the pharyngeal wall, then we would want to turn the head to the weak side and then swallow. Or a head tilt, so a turn versus a tilt. And I know you can't see me, so we can talk about these in lecture as well. And then lying down is also one. So take the time, maybe pause the lecture, take the time to go through those and try to do each one of those strategies on your own. The next one, we have some very specific strategies here, and I'm going to go through them so that you understand these. So you have the supraglottal swallow. So what this is that you're going to hold your breath the entire swallow, and then you voluntarily cough, swallow again. And this is really good for a patient who has been aspirating. So again, you're going to hold your breath the entire swallow, voluntarily cough, and then swallow again. Really good for aspirating patients. That's number one. The next one, the super glottal swallow. The only thing that you're doing all the steps as before, but this time you're just adding some effort. So push down on a hard surface to help you. So essentially you're putting your hands on a surface and you're pushing down as a way to help you get that swallow down. So all of those steps, the holding the breath, voluntary coughing, swallow again, but then just as you're swallowing, make sure you push down on the surface as well. So try each one of those. Grab a snack, try to do these swallows. An effortful swallow is when you squeeze the muscles needed to swallow. So essentially if you want to think about it, it's kind of like swallowing a golf ball. So you're squeezing the muscles really, really hard, and then you're swallowing really hard. So essentially it's thinking about that swallow and then swallowing it down. The Mendelssohn maneuver on this one, the patient will place their hand on their throat to feel their laryngeal elevation. So when you are swallowing, you do want to have that laryngeal elevation. So you're going to hold the larynx up before you swallow. So this one's pretty tricky. This one's actually really hard. And if you don't have challenges swallowing, this one's going to be really hard to do because you are going to automatically your laryngeal elevation is going to happen and then you'll swallow. So see if you can do it though. See if you can hold the laryngeal, hold it up, the larynx up, and then swallow. So this is really good after a brainstem stroke. And then the final maneuver here, what you're going to do is you're going to hold your tongue between your teeth while you're swallowing. And this is really good for patients with reduced pharyngeal contraction. So all different techniques that you can try. So I want you to try each one of them and we'll talk about them in class as well. And we can go through kind of how did that feel and kind of talk about who they might be really good for. All right. Other things that you can do are strengthening exercises. So remember, we talked about compensatory strategies. So that was our first one. You have compensatory strategies. Oh, I apologize. I went too far. Give me just a second. We have compensatory strategies, therapeutic strategies, and strengthening. So compensatory strategies. We have some therapy strategies. And now we're going to look at strengthening exercises. So this shaker exercise, and I want you to try this as well. Lay down, lift your head for a minute, and relax. And you're going to do this 3 times. So these are just exercises to help with strengthening. Your tongue exercise, again, you're going to hold that tongue in a retracted position, gargle, and then move the tongue horizontally. So try that. And then transference of treatment efforts. So this is going to be like your LSVT or speak out. And this is like a voice therapy that you would go through a training for that. So there's other things that we need to take into consideration. So some of our clients might need some sensory stimuli because they just don't have that sensation, and so we might need to encourage that. And then many of our patients actually have some sort of dietary change that's happening. So whether they're going on purees or they're going on chopped or they're going on a liquid, like all sorts of things that can be going on. So we really need to consider, has there been a dietary change that's taken place? Or has there been some kind of surgery or medical procedure that has taken place that's preventing them from being able to participate in some of these activities? So you always want to think about that when you are referring them, when you're thinking about those treatments for our patients who have a swallowing disorder. So again, someone who is actually working in with clients right now gave me this one. So this should not say speech. I apologize. This is a mistake. Should not say speech. This should say swallow. That is an error there. So just get rid of that and make it say swallow. So one of my colleagues gave me this. So a patient will consume soft and bite-sized solids. And so you're looking here. So they're looking to do that bite-sized solids, and they're trying to avoid that aspiration in 80% of the trials. And again, you'll notice with minimal cues and use a swallowing strategy. Okay, so it's a little bit different. It's quite different than some of the other goals that we've written, but I wanted you to have an idea of what a goal might look like if you're doing swallowing. So part of our job, like we said, is assessment. And in this course, we're really talking about assessments. So the basics of an eval, our job is to say, what are the concerns of the patient? What are those contributing factors? And going through each step of that eval, of that swallow with them. So remember, this is a really, really critical portion, making sure that we're doing that quality of life survey. We really need to make sure we're doing an oral mech, make sure there's no hearing or vision. And then we're assessing each part of that swallow and the procedures for this particular client, which we'll go through in class in more detail. But this is our job for a basic swallow eval. And then education is a big piece as well. A lot of the times with the clients that we have, you're going to get adult clients who don't want to necessarily follow some of the rules that you're going to put in place, or let's say guidelines. Let's not call them rules. They're more like guidelines. Name that movie. Anyway, so it's going to be really challenging to get buy-in with many clients because you're asking them to change the way that they're eating. And so education is really, really critical, that we're explaining to them, why are we asking you to do this? And it's for their safety, so that they know that it's really critical. So again, we're going to give them this eating assessment tool. So this is really similar to the one we gave to other clients, but this is particularly about eating. But this is that quality of life, like basically asking them, how do you feel about your eating? How are you feeling about how things are going? So here's a case study. We have this 60-year-old and they've gone through chemo and they're in remission, but they do have dysphagia. So they're having some issues with the swallow. So in the past, because of radiation, they had swallowing issues, and now they want to return to this solid diet with swallowing strategies, but they have to avoid problem foods, right? So there are certain foods that are going to give them problems. So they do state that food and pills get stuck in the throat. So obviously that's something really, really critical that we need to know. And if they're coughing on liquids, that's really, really critical that we need to know that, because coughing is a sign oftentimes of aspiration. So that can be delayed or like immediate. And so we do have to pay attention. Is this client coughing every time they're taking a drink? So this particular client says when they drink too fast is when it happens. So other things that we have to take into consideration in the oral mech, we need to notice that these are some things that are reported. So is she able to, does she have control of all of her articulators? Is she able to swallow? And we need to know what's going on. So things that we want to pay attention to, obviously that hoarse voice is really important. We want to look at, are there any issues with symmetry? So no, this is really great. She's symmetrical, that's really good. And just looking at the face and lips and jaw and just saying, how are we doing? And we're going to go over this in more detail in class as we go through doing an oral mech, but just what are the things that we need to look out for? And then what we want to see is we're going to look at this oral trial. So you will conduct this oral trial as well. And we're going to have the client actually consume ice chips, water, applesauce, and crackers. And this is really typical in a medical setting, that you're going to just have these things in your pockets at all times. And we want to make sure that there is no spillage. That's really, really critical. And then what we want to know is, are they coughing? Is something going on after each one of their bites that they are being given? We also want to give them this particular assessment as well. And so what you're going to do is you're going to take all of this information and all of this information and this information, and that's what is going to go in your report that you're writing about the patient. And that's what we're going to be practicing in class. What is going to go in that report for the patient? So that is it. We'll talk about some questions really, really quick. Here's some references where this stuff came from, but we will go over this in class in more detail. But hopefully you have an idea of what we would be assessing and then how that would take place. And please come prepared with the questions that you might have. All right, see you all later.